My name is Christina Kelly. I'm the leader for the Workforce Education and Development Team for FMA Health. I'm faculty at Savannah Family Medicine Residency Program and director of the Mercer University School of Medicine Accelerated Track for Primary Care. So our charge initially was to produce the diverse primary care workforce that America needs to be able to serve patients and communities. So that really looking at high school students all the way to after people graduate from residency and are in practice. We really had a large focus on how to have medical students choose family medicine as their specialty choice. And so we looked at that using something called the 4 pillars of primary care workforce reform, looking at pipeline, the process of medical education, practice transformation, and payment reform. A lot of the things that we focused on were in the first 2, so for pipeline, looking at how to build a diverse workforce and how to see what factors medical students are choosing in terms of specialty choice. For the process of medical education, we looked at advocacy development in students and residents, leadership development in students and residents, kind of what is it that is going to make a difference in our medical education process for students to choose family medicine, and so looking at making sure we have enough high quality preceptors to teach the medical students. And then the last part we also started to look at was making sure that we have enough residency slots for those students so they could get the training they need after they graduate from medical school. Well, in order to take care of patients and communities, we need to have the diverse primary care workforce to do that, to improve patients' health and their care and to lower the cost of health care. And so I think workforce is really at the heart of that, and so that's why it's important. So there's a lot of changes always going on in medical education, and so any of those that have happened have impacted our work. One is looking at the number of residency slots for medical students after they graduate, and the single accreditation system that is happening between allopathic and osteopathic schools. So that has changed how we've started to really look at student specialty choice, because if we have all these students choosing family medicine but we don't have anywhere to train them, then that is a problem. So for the pipeline, we really need to identify the right time to encourage people to not only go into family medicine, but realize that they can be a family doctor too in the future.